I'm going to bring our next speaker on the stage. Obviously, before that, we are going to be talking about, since we are looking at the relooking cancers of the reproductive organs through the functional medicine lens, we have another very important topic that's coming up, which is ovarian cancer. Definitely, ovarian cancer remains one of the most significant health challenges for women worldwide. With definitely with early detection and effective management, it is improving outcomes. So that's the reason we have Dr. Kalpana Shekhawat. Let me please bring her on stage.
Morning.
Uh,
Hi.
very good
Good
morning, Dr.
morning.
Shekhawat.
Good
Really nice
morning.
to see you.
Same here. Thank you. And thank you, IAFM. Thank you, Dr. Preeti, Dr. Ashwini, Dr. Ruhi, Dr. Anish, and to you and Renuka as well for coordinating this whole thing. I'm sure it's a huge task. So thank you, everyone.
Thank you so much, Dr. Shekhawat. Allow me to just introduce Dr. Shekhawat. So, Dr. Kalpana Shekhawat is a functional and a metabolic medicine specialist and the founder of Freedom Age. She has over 14 years of experience and she has been at the forefront of integrating functional medicine to address the root causes of health condition. And in today's session, she's going to bring her valuable insights on the functional medicine approach to ovarian cancer management and prevention, definitely offering us new perspectives on this critical issue. So, all the stage is all yours, Dr. Shekhawat.
Thank you. Thank you, Amarjeet. I'll just try to do my screen share myself. I hope I'm able to do it myself.
Sure.
Okay, so I'll start without wasting time. So we are talking about managing and preventing ovarian cancer with functional medicine. So I'll just talk about the basics. That is, what could be the signs one has to look for in ovarian cancer. So when we talk about ovarian cancer, it's primarily the hormone dependent cancers that we are talking about, because most of them have the same root, same origin. And when we are talking about ovarian specifically, yes, we are talking about others as well, which could be endometrial or could be breast or other hormone cervical, other hormone dependent cancers. So we're going to talk about the root causes, which could be responsible for turning these cells cancerous. Then we're going to be talking about some preventative strategies, and then we're going to be talking about the management that we do in functional medicine. So the early signs can be bloating, abdominal and pelvic pain, difficulty eating or feeling full quickly, frequent urination, weight loss, fatigue, back pain, changes in bowel habits. And the root causes are, this has already been discussed widely by many speakers, that many genetic factors are responsible. So BRCA mutations, BRCA1, BRCA2. So I'll not spend much time on all this, but I'll run through this. So BRCA1 responsible for 39 to 44% increased risk of ovarian cancer, and BRCA2 11 to 17% increased risk of ovarian cancer. Then there are epigenetic influences, which are so we always say that in functional medicine that if it is 20% genetic, it is 80% what you have control over, which is the epigenetic factors which you have control over, and you can turn this around. So epigenetic changes involve alterations in gene expressions without changing the DNA sequence through mechanisms like DNA methylation, histone modification, and micro RNA regulations. And these alterations lead to tumor-forming cells. And defective methylation, which has been widely discussed, reduces the efficiency of DNA repair, increasing the accumulation of mutations in ovarian cells. Methylation defect can impair estrogen clearance, leading to estrogen dominance, which stimulates ovarian cell proliferation and raises cancer risk. Estrogen dominance, which Dr. Mahesh has discussed. So estrogen promotes the growth and proliferation of ovarian epithelial cells and endometrial tissues, which leads to development of endometriosis. So chronic excess can lead to unregulated cellular growth, increasing cancer risk. And sources of estrogen dominance include obesity. Most of the women in their postmenopausal phase, they struggle with obesity, and there are fat deposits, especially in the belly area. And these fat cells, they produce a lot of estrogen, and exposure to xenoestrogens, example, BPA phthalates, etc., are another reasons. So estrogen is basically, there are three different types of estrogens. Estrone, that is E1, which is the least common when you are young and primarily produced after menopause, maybe the underlying cause of estrogen-dependent cancers. Then estradiol, which is E2, the most potent and biologically active estrogen, which is dominant in premenopausal women. And estriol 3, which is, I feel, is the healthiest and the weakest estrogen because it is predominantly secreted during pregnancy, during youth, and is highly protective. Estrogen metabolism is in phase 1, phase 2, and phase 3 detoxification. I'll be primarily talking about phase 1 and phase 2. Phase 3 has already been covered up. So in phase 1 and phase 2, metabolism is in the liver. So liver is the most important organ that we have to focus on, apart from gut, which has already been discussed. If your liver is healthy and is happy, then surely it will metabolize your estrogen well, and your chances of getting estrogen-dependent cancers is much lower. So again, your diet and lifestyle plays a major role. So estrogen metabolism occurs primarily in liver through 2 phases of detoxification. Phase 1 is 2-hydroxyestrogen, where which is most protective and does not cause cellular and DNA damage and cancer. It rather protects against cancers by preventing proliferation. Then the other pathways are 4-hydroxy and 16-hydroxy, which are potentially harmful, associated with DNA damage and cancer risk. And 16-hydroxy is again a potent and estrogenic, which is linked to cell proliferation, so again risky. So the low ratio of 2-hydroxy to 16-hydroxy can lead to dysplastic or tumor-forming cells, hence increased risk of hormone-dependent cancers. So both 2 and 4-hydroxy metabolites undergo methylation before they are released. Optimum COMT, that is catechol O-methyltransferase, can make 4-hydroxy less active and less dangerous, while poor COMT increases risk of oxidative stress and DNA damage. So again, this is a genetic component which is important in this metabolism. Decreased COMT contributes to increased estrogen levels, and normal COMT helps balance estrogen levels. Genetic variations in COMT influence ovarian cancer risks. And DNA damage causes chromosomal instabilities, leading to changes in the structure chromosomes, which can cause tumor-forming cells. Then we come to the phase 2 detoxification, which is conjugation. Conjugation with hydrophilic compounds such as glucuronidation, sulfation, glutathione, amino acids, acetyl and methyl groups are transferred onto the and they transform estrogen metabolites. So this transformation makes them hydrophilic so that they can be excreted in the bile and urine. And glucuronidation of 2-hydroxy is supported by compounds such as resveratrol, DIM, and calcium D-glucarate, which we already discussed. Now, if 2-hydroxy is methylated by COMT, instead of glucuronidation or sulfation, then glutathione's S-transferase finishes the phase 2 detoxification. So GST helps turn these metabolites safer and prevents damage. That's why keeping your glutathione levels up is very critical. Then methylation of 2-hydroxy and 4-hydroxy estrogen with the help of COMT is important for decreasing the toxicity of these metabolites and hence health risks associated with accumulation of these. Methylation can be supported with methyl donors such as methionine, B6, B12, folate, betaine, choline, and magnesium. Another important factor which is responsible is progesterone deficiency. So progesterone is the first hormone which gets knocked down after 30 to 35 years of age in most of the women. That's because of the stress and lifestyle factors, and deficiency can result from anovulatory cycles, stress, high cortisol inhibits progesterone, or aging. So low progesterone levels leave cells vulnerable to estrogen-driven growth and inflammation. And causes of low progesterone can be high levels of estrogen can disrupt the balance between estrogen and progesterone, leading to progesterone imbalance. Women with PCOS often have hormone imbalances, including low progesterone levels, and stress disrupts HPA axis and causes low progesterone levels. Then very important part, gut and microbiome factors, which are also responsible largely for hormone-dependent cancers. So gut dysbiosis and imbalance of gut microbiome can lead to chronic inflammation and increases the risk of ovarian cancer. Gut dysbiosis contributes to metabolic dysfunction and impaired gut barrier function. Gut microbiota influence estrogen metabolism. Altered gut flora leads to estrogen dominance and increased risk of estrogen sensitive cancer. I'd like to add here, we have many patients in our clinic where, I largely work on gut health and autoimmunity. And we find the gut to be most unhealthy part in the entire investigation that we do. We find a lot of dysbiotic flora. We find Citrobacter, Klebsiella, Staph. We find E. coli, we find Salmonella, and multiple other disruptive biome, which basically is responsible for damaging the gut lining, and it backfires on your liver also. So what we talked about just now, the metabolic pathways, phase 1 and phase 2 detoxifications, they also get impacted if your gut is unhealthy and it is backfiring on your liver. So leaky gut syndrome, increased gut permeability can allow toxins and undigested food particles to enter the bloodstream, contributing to inflammation and cancer development. It can weaken the immune system, making it less effective in detecting and eliminating the cancerous cells. Toxins and undigested food particles that pass through the gut wall can stimulate the growth of ovarian cancers. Leaky gut syndrome can disrupt the balance of gut microbiome, leading to changes in the way the body processes and responds to hormone toxins, and other substances. Another important factor in environmental toxins is the heavy metals. So we all have been doing the oligoscan, and we also do the urine heavy metal testing. And we find these to be very high, and especially if there are underlying infections, then there is high retention of heavy metals. Especially we see in Candida positive cases that, the Candida infection, it also binds heavy metals inside the cells, and it disrupts the metabolic pathways, including the insulin metabolism, which we have seen most commonly associated with high levels of cadmium. So this is also an important factor to be looked into, environmental toxins which contribute to ovarian cancer by disrupting cellular processes, altering hormone regulation, and inducing chronic inflammation. Found in cigarette smoke, even the pollutants outside, even the tire dust, if we when we go outside. So these all contribute. Fertilizers, industrial processes, they all mimic estrogen, which are xenoestrogens, and they fuel estrogen sensitive cancers. Then other endocrine disrupting chemicals, which are bisphenol A, phthalates, pesticides, plastics, the plastic bottles, food containers, aluminum food containers, they all disrupt ovarian function and the normal hormonal cycles. And the cosmetics, for sure. Substances that directly cause cancers by damaging DNA or interfering with cell regulation. So these are the carcinogens. The occupational exposure to asbestos or talc-containing products is linked to ovarian cancer. There's a specific study to this, and this has been found, this association is found positive. Carcinogens initiate genetic mutations and inhibit tumor suppressor genes. They promote a pro-inflammatory environment conducive to tumor development. Then we talked about insulin resistance. Like I said, that there was a very typical case when we had the cadmium toxicity was very high, and there was a huge insulin resistance in this woman. And when we removed cadmium from her body, we could basically turn back the insulin resistance. So this can lead to increased androgen production. High insulin levels and chronic inflammation can impair apoptosis, allowing damaged cells to survive and potentially become cancerous. Central obesity causing inflammation and insulin resistance. Dyslipidemia characterized by high triglycerides and low HDL cholesterol and hypertension due to damaged blood vessels, they all contribute to increase in the risk of ovarian cancer. Omega-6 to omega 3, fatty acid ratio, a very important component, because most of the people are consuming too many vegetable oils in today's time, and this ratio is getting disrupted. So instead of it from omega-6 to omega-3 4 to 1, it's turning to 16 to 1 or even more. And that's causing high inflammation to the cellular lining, and it increases the angiogenesis and having pro-inflammatory effects, which promotes the growth of ovarian cells and increase their metastatic potential. Stress and emotional factors, a very important aspect. Unresolved emotional trauma or post-traumatic stress disorders, they cause chronic stress and disrupt hormonal balances, leading to increased cortisol levels, which impairs immune function, making it more challenging for the body to detect and eliminate cancerous cells. Repressed emotions such as anxiety, depression, trauma, emotional stress due to relationship, finances, work, and women having difficulty in expressing their emotions are more likely to develop ovarian cancer. So now we come to the assessment part. So we have the genetic testings available to us, thankfully, and we've been doing it for many of our patients if they are very worried and if they have family histories of cancers. So BRCA mutations, then MTHFR, and then COMT pathways also we look at. Then we look at estrogen metabolism through Dutch testing. So we look at 2-hydroxy, 4-hydroxy, 16-hydroxy pathways. We look at COMT metabolism. We look at, of course, methylations and what pathways are being followed. If there is high risk, then of course we work on detoxification. So cortisol levels, evaluating stress-induced hormonal dysregulation contributing to inflammation and immune suppression. So these are again important aspects in assessing. Then we look at inflammatory markers like C-reactive protein, TNF-alpha, LDH. So these support us in helping us in arriving at a conclusion that how much intervention the patient basically requires. We also look at CA-125, but primarily when we are treating the patient, because we keep seeing the changes in CA-125. So we do it in the initial assessment, and then we keep watching for this marker over a period of time while the patient is undergoing therapies and treatments. So after successful treatments and remission, regular CA-125 tests are performed to detect any recurrences also. An increase in CA-125 levels may precede clinical symptoms or imaging findings, allowing the early intervention to take place. As already discussed, we do microbiome analysis. So so microbiome analysis helps us to evaluate dysbiosis and leaky gut, which contributes to systemic inflammation. Systemic effects to assess microbial imbalances. Like I said, that we see a lot of dysbiotic flora in many of our patients, and then when we correct them, they come back with healthier gut. They come back and they report that they're feeling much better in terms of the gut health and the mental health issues also when we eradicate the underlying infections, and their liver is happier. They lose weight because the toxic load of the liver, which is the constant secretion of the lipopolysaccharides from these microbiomes, which is loading the liver, gets reduced. So we basically turn around the entire metabolic pathways, and we give a protective shield to these patients by addressing their gut. Then we do the Dutch test, assess the hormonal health by providing detailed insights into hormone levels and metabolism, critical for ovarian cancer management. We do the comprehensive stool analysis for sure. Like I discussed that even blastocysts, salmonella infections, apart from the others that I spoke about, the Citrobacter, the Klebsiella, the Staph and Strep, and many others. These infections and even the protozoal infections like entamoeba, so they all are responsible for causing dysbiosis in the gut, and we measure the level of dysbiosis and the damage to the gut with the help of calprotectin, lactoferrin, secretory IgA. So these very lysozymes, these are very important markers which basically tell us the level of damage that the gut lining has, and then we offer correction to these patients. The other thing is the mold toxicity and latent infections. Chronic mold toxicity and latent infections can contribute to systemic inflammations, immune dysregulation, and toxin overload, all of which may exacerbate cancer progression and hinder the body's ability to respond effectively to treatments. Candida overgrowth, we definitely check for because we have seen many of our patients suffering from this. So we do not really look at removing the yeast overgrowth or candida overgrowth, but we look at balancing out, because we see that when it is overgrown, then it basically proliferates into the cellular lining, and then spores, they break down and they almost capture the cells, and they cause major hormone imbalances because they even bind to your estrogen, progesterone, and many other hormones. So it's very important to look at balancing out the yeast overgrowth or candida overgrowth, which is found with the help of lifestyle factors and various detoxification protocols. EBV, again, important marker, because if it is active, though it is found in many patients, and most of our patients post-COVID have been found positive to this, but if it is positive, then we have to balance it out. We have to work by keeping the levels under control. Similarly, Lyme disease, I'm very fond of testing this in my clinic because I find so many of our patients positive, and so many of their symptoms that they come up with can be related to this. And then when we start working with them on eradicating this infection, because this is a chronic condition which develops, goes to intracellular level, and most of the times goes undiagnosed. So it's very important to look at this as well. The Candida markers, IgG and IgM. So this is how we test them. We definitely do the food intolerance testing to know and remove the intolerant foods which the patients may be consuming at the time when they're healing. Though the intolerances are reversible when we are able to heal the gut, but at the time when we are treating, we would not like to put further pressure on the gut. So we would like to remove these foods which are not working with them, and then gradually reintroduce when they start healing. Another important marker that I always test for is circulating tumor cell count. So this does give us an idea about the metastatic levels also. So we send a 10 ml sample to the lab, and we check the number of circulating tumor cells in that. This is also an important marker for finding out the progress of the treatment, that how good the treatment is progressing. Are these markers coming down? Are these metastatic markers are reducing? So it gives us an idea that yes, we are on the right track and things are falling in place. So we talk about the preventative strategies. Regular screening is very critical. Early detection through regular checkups and genetic testing for individuals with family history of BRCA mutations. Healthy environment, minimize toxin exposure by choosing clean, non-toxic products and maintaining a healthy lifestyle. Maintain healthy weight. Obesity increases the risk of ovarian cancer. A balanced diet and regular exercise can help achieve and maintain healthy body weights. Quitting smoking and reducing your exposure to the environmental and industrial pollutants also is a very important part. Supplementing with supplements and natural therapies, basically keeping your metabolism healthy, is a very important aspect of preventative care. Regular intake of anti-inflammatory and immune supportive supplements like curcumin, green tea extracts, selenium, estrogen detox may help reduce overall cancer risk. Probiotics and gut health. A healthy gut microbiome plays a role in regulating systemic inflammations and hormonal balances. Then stress management, again, like we talked about, is a very, very important aspect of preventing any hormone-dependent cancer. Hormone healthy diets, anti-inflammatory foods reduce oxidative stress and regulate immune responses, such as, and these foods could be fatty fish, which are rich in omega-3, leafy greens, kale and spinach, cruciferous vegetables, because they have indole 3 methionine, so DIM I3C is a very important supplement for reducing estrogen dominance. Turmeric with black pepper, ginger, and garlic, they work very well. Cruciferous vegetables, like we already said, indole 3 carbinol and sulforaphane, which support estrogen metabolism. may reduce the risk of hormone-related cancers. These compounds help detoxify harmful estrogen metabolites, which may contribute to tumor growth. High fiber diet, I highly stress upon this. Many of my patients who have been following keto kind of diet, especially they are overdoing on it and reducing the fiber intake in their diet, are having a compromised liver for the reason that liver needs to be happy and it needs to have basically lighter food to digest. If we constantly and consistently give heavier foods, which are basically the flours which are made out of nut powders, which is like almond flour or coconut flour. So if we overdo on these, and if we eat too many of fats and too much of quantity of nuts in our diet, this can adversely impact your liver, can actually stress your liver big time and sabotage your weight loss goals, apart from of course intoxicating your liver. So the liver, if it is already intoxicated because of the unhealthy gut due to dysbiotic flora, and if you are overdoing on your keto diet, then this sets a stage for disaster. So one has to be very careful on the kind of diet that you choose when you are detoxing yourself. So the liver supporting foods, maintaining a healthy liver is vital for detoxification, metabolism, and nutrient processing. While the keto diet can aid in weight loss and metabolic conditions, it may stress the liver over time due to high fat content. A high fiber diet, on the other hand, supports liver health by promoting detoxification, reducing inflammation, and improving digestion. So these can be grains such as quinoa, ragi, brown rice, buckwheats, legumes, fruits, healthy fruits. Banana is very good. If you do not eat a very highly ripe banana, it's very healthy. It's a wonderful prebiotic to your gut. Then other vegetables like beets, sweet potatoes, even potatoes if they are consumed in moderation, green peas, all of these can keep your liver healthy and happy. The advanced therapies that we do in our clinic for managing patients. So we have mostly managed stage 1 and stage 2 cancer patients. We do not work much with stage 3 and stage 4, except that we give them support to the conventional treatments that they are doing, because of certain limitations of these therapies, which are posed if they are not able to comply to the dietary guidelines or to the specific lifestyle factors that we advise them, then only doing functional medicine therapies may not completely give you the right results. So I always try to tell them to do what their mainstream doctors have advised them, and alongside, of course, follow the guidelines which we advise them. And they can also switch to some of the therapies, like, of course, nutraceuticals are a very important part, and we give to all the patients irrespective of the stage of the cancer that they may be in. So these are basically the potent antioxidant, anti-inflammatory, immunomodulatory, and anti-cancer properties of certain nutraceuticals such as vitamin C, E, beta-carotene, curcumin, resveratrol, and of course promoting detoxification of the toxic estrogen levels which they may be having, of course boosting the levels of progesterone in these, balancing out their thyroid. So balancing the complete metabolism goes a long way in handling this. These compounds, so the nutraceuticals, they target molecular pathways involving in cancer development and progression, including oxidative stress, inflammation, angiogenesis, formation of new blood vessels that fuel tumors, and apoptosis, which is a programmed cell death. Vitamin D levels are very, very critical. They regulate cell differentiation and inhibit cell growth. So low levels of vitamin D are associated with worse ovarian cancer prognosis. Then omega-3 fatty acids, again, very critical part, and the ratio between omega-3 and omega-6 has to be optimum. So fatty fish, flax seeds, walnuts, reduce inflammation by suppressing prostaglandins and cytokines, slow tumor growth, and enhance sensitivity to chemotherapy. Fish oils, they supplement with EPA and DHA and are preferred for high potency. Liver cleanse with the help of dandelion, N-acetylcysteine, and various other herbal nutraceuticals is a very critical part of our treatment. And selenium, it strengthens the cellular and antioxidant defense and prevents the progression of hepatic fibrosis. So we always supplement our patients with these basic nutraceuticals. Candida cleanse, again, we basically clean the parasites which may be residing in the gut. So this aids to removing and eradicating these underlying latent infections. Then vitamin C, we give in the form of oral as well as IV therapy, coenzyme Q10, D3K2. So then biofilm bursting treatments, very important part. When there has been long-standing dysbiosis in patients, there is a great possibility and almost always that there are multiple biofilms which are formed. So patients who come with waxing and waning cycles of feeling better and then again feeling worse, feeling better and then again feeling worse, that clearly means that there are underlying biofilms which basically come back after the parasitic cycle is completed. So we have to consistently and constantly keep on working with them on cleaning their gut with the help of biofilm bursting protocols. We do enemas also to remove these biofilms, which basically are a specific mix of multiple herbs as well as the heavy metal removing products, which are such as EDTAs. Then we have charcoals, and we add about a mix of about 10 to 12 herbs, and they work beautifully when they are done like on weekly basis to burst these biofilms. We have seen great results with these. But there are other oral supplements also which are available. So I don't know how effective they are, but the enemas have worked beautifully in our practice.
Dr. Shekhawat, you would have another 3 minutes.
I'll
Request you to do it. Thank you.
Then we do molecular hydrogen therapy. It's a highly antioxidant therapy which can combat oxidative stress. This selectively reduces harmful free radicals and stabilizes mitochondrial function and reduces DNA damage. They protect healthy cells and oxidative damage and enhances overall antioxidant capacity. For infrared therapy, we all know by generating heat shock proteins, this therapy works beautifully. So they remove a lot of toxins by inducing sweating, and they remove a lot of heavy metals as well and toxins, and therefore highly anti-inflammatory. IV ozone treatment, again, a very important part of our therapy. We give it in the form of IV saline, we give ear ozone, we give intravaginal ozone or intrarectal as well, depending on the requirement. And they work beautifully in gut cleansing as well as oxidative, reducing the oxidative stress and oxygenating the cells. Cancer cells are anaerobic, so why ozone therapy has been working beautifully, and hence ozone floods these cells with oxygen in several ways. It makes RBCs release more oxygen at tissue level. It improves general circulation. It leads to new vessel formation inside the tumor. And ozone, by making tumor environment normoxic, makes it very difficult for hypoxic cancer cells to survive. High dose vitamin C. So we start with the low dose, which is like 15 grams. Then we go to 30 grams and then 45, 60, and go up to 100 grams, depending on the patient's tolerance. One has to be very, very careful about checking the levels of G6PD before switching to high dose vitamin C therapy. But high dose vitamin C, if it is given in the right manner, is considered to be as good as chemotherapy in basically killing or eradicating the tumor cells. Cancer patients are often also depleted in vitamin C, and IVC provides an efficient means of restoring tissue stores. It reduces inflammation, and which is measured with the help of C-reactive protein that we check regularly for these patients, and we find that the levels, they start going down. So it gives immune system support. It has antioxidant. It gives antioxidant protection, powerful antioxidant, and it reduces stress. So I'm going quickly now. So if there are any questions in the end, I'll be okay to take, and I'll answer them separately. We give modified Myers to basically support the metabolic system. We do regular detox protocols, elimination diet, low histamine diet is often given to these patients because MCAS is often associated in patients who are dysbiotic. Then probiotics, vitamin C, activated charcoal, milk thistle, dandelion roots, turmeric, sauna therapy, exercise, meditation and stress reduction, sleep and relaxation. Yeah, so that's what about it. If there are any questions, I'll be happy to attempt. I'm sorry I had flu, so maybe I was a little haphazard, but I didn't want to miss this opportunity to talk. So I'm thankful to everybody for giving me this opportunity. Thank you so
We
much.
are extremely thankful that you have taken out your precious time. And of course, you're not feeling well as well. And still, you are
Yeah,
standing there and giving. You can see a lot of hearts coming in. I would really appreciate participants. Yes, even the speakers are giving in their valuable time. We really love it. Thank you so
thank
much.
you.
And Dr. Shekhawat, in the interest of time, what I'm going to do is I'm going to go to the next session. I would request you to kindly look into the Q&A and the chat box as well, because there were a
Sure.
couple of questions related to this. Thank you once again, and take care. Take care.
Thank you. Thank you so much.